Ovarian cancer is one of those cancers that have very vague symptoms. So oftentimes patients may have some indigestion, some bloating, they may have a little bit of nausea. Things just don't necessarily feel right in the abdominal or pelvic area. And they oftentimes present to their primary care, may get referred to a GI or gastroenterologist, and then finally get a scan, and something suspicious on the scan shows up in the ovary. And sometimes there's even disease that looks like it's present already outside of the ovary in the peritoneal cavity. There are no good screening modalities for ovarian cancer. So the best that we have for patients that are higher risk, so patients that have a family history or a known genetic predisposition towards ovarian cancer, is actually doing pelvic exams, so seeing the gynecologist regularly for pelvic exams, approximately every 6 months or so, doing a transvaginal ultrasound, and also checking a tumor marker called a CA125. So that's what we do for patients that are higher risk until they've completed childbearing. And if you're high risk and you've completed childbearing, we actually recommend something called a risk-reducing surgery. So that's where we actually recommend that you remove the ovaries and the fallopian tubes, because that will significantly reduce your risk of developing ovarian cancer. But of course, again, that's for patients that have completed childbearing. I try to manage all aspects of women with reproductive tract cancers. So not only the surgical care, but the medical care, the chemotherapy or immunotherapy, whatever targeted therapy might be most appropriate for them. And then I also do aggressive symptom management for my patients. So that will include managing pain, nausea, vomiting, any symptoms that occur because of the cancer. And this is considered to be giving a more palliative approach to managing them as well. So all of that is combined. And it doesn't mean that they're not getting aggressive cancer care, it just also means that they're getting good symptom management along with their care for their cancer. So really comprehensive care. There's a multidisciplinary tumor board that happens every Tuesday. And so for different cases that may not be the most straightforward, we have our pathologist there, we have our radiologist there to look at images, we have other physicians or oncologists there. So we have a whole team there to look at different aspects of the case and come up with the best recommendation for that patient. There's lots of hope, I would say. I'm very happy to see that patients nowadays, sometimes I'm taking care of patients and we thought that we've exhausted most of the good treatment options for them. And then there's a new FDA approval for ovarian cancer based on some new molecular testing. And I would say that's happening maybe at a frequency of every 6 to 9 months roughly nowadays, which is fantastic news. And maybe one day we'll achieve a cure. Currently with maintenance treatments, patients are having a much longer time before disease ever comes back. Before maintenance treatments, unfortunately for advanced stage ovarian cancer, the disease would come back within a year and a half or so. With the use of maintenance treatments, it's several years for the cancer to come back and sometimes doesn't come back. There's no need to look outside of Holy Cross. You can certainly get good comprehensive care for your cancer here at our institution. It's going to be the same standard treatment. You need aggressive cytoreductive surgery, which I will provide. You need chemotherapy, which is the standard is carboplatin and paclitaxel. And there's maintenance treatment that you will likely be placed on after you're finished with the surgery and the chemo. And this is standard wherever you go. So probably the most important thing is if you have good family support here or other support, then stay where you have that support, especially for that initial treatment. Again, if you exhausted many of the treatment options, then at a certain point, I may have that conversation with you that it's time to look outside of Holy Cross. But for most patients, for most of these patients with this diagnosis, you will get excellent care here at Holy Cross.